Hi, and welcome to MansMatters, the erectile dysfunction and Peyronie's disease Shockwave clinic. Today, I want to discuss the difficult subject of Peyronie's disease and teenagers. Peyronie's disease can affect men of any age, and we have treated youths in their early teens through to men in their 90s. Characterized by a bend or deformity in the penis, Peyronie's disease in teenagers or young men can have serious psychological impact as well as sexual problems. While it is difficult to cope with this condition at any age, it is particularly devastating for a teenager who is at the early stage of maturity. Boys tend to be much more withdrawn than girls when it comes to coming forward about their medical problems, and with teenagers, the condition is compounded even further. How on earth do you tell your mum or dad or girlfriend that you have a bent or deformed penis? Peyronie's disease in teenagers often occurs as a result of an injury. A painful kick in the ghoulies at school, remember those? A boisterous tackle on the rugby pitch, trying to hurdle a gate which goes wrong, or over-vigorous masturbation can all be the trigger. There are very few men that have gone through life without feeling the excruciating agony in the private regions following an accident, whilst their friends gleefully laugh at their misfortune. Very little research has been undertaken into Peyronie's disease and teenagers. One study looked at 32 teenagers aged 15 to 19 versus men aged 40 plus over a 10-year period, to see whether there was any defining or differentiating factors between the two groups. The study found that 22% of the teenagers with Peyronie's disease experienced painful erections, and 37% subsequently developed ED. Peyronie's disease is characterized by a non-cancerous fibrous plaque that stops the penis expanding on one side. In older men, it is normal that there is only one plaque. With teenagers, there was a 700% increase in multiple plaques, and this is backed up with our clinical experience. The psychological implications were huge, with 94% of patients reporting a high level of stress, and over a third had already sought medical help for anxiety and mood disorder, and 28% had had a negative encounter with a sexual partner. Teenagers also have a higher HbA1c level, which measures average blood glucose, than older men. We advise any teenager watching this to share their condition with their parents and doctors, and if suffering from depression, to seek counselling. Up to 10% of men suffer with different levels of Peyronie's disease. But unlike other conditions such as diabetes, many teenagers and men find it very difficult or sometimes impossible to discuss the condition with others. Extracorporeal focused shockwave therapy, with its ability to break down the fibrous plaques, is the only non-surgical longer-term solution for teenagers who want to avoid life-changing surgery. This treatment is widely discussed in our other videos. Focused shockwave therapy creates new and repairs existing blood vessels and rejuvenates nerve tissue, leading to fuller and harder erections. It also breaks down plaque in Peyronie's disease, which causes the bend in the penis. To learn more about Peyronie's disease shockwave treatment, visit our websites at mansmatters.co.uk or peyroniesdisease.co.uk. and check out our YouTube channel's videos, Erectile Dysfunction Cure and Peyronie's Disease Cure. These provide a comprehensive overview on all treatment options and a detailed animation of the shockwave therapy.